Catheterization procedure. Catheterization is a medical procedure used to insert a catheter into a patient's urinary tract. It is crucial for patients who are unable to urinate independently or require continuous urine drainage. In this lecture, we will discuss the key steps involved in the catheterization procedure. Before you begin the catheterization procedure, several preparatory steps need to be followed. Let's go through each one. 1. Check the doctor's orders. The first step is to check the doctor's orders carefully. Ensure that catheterization is medically necessary and that the size of the catheter matches the order. 2. Gather equipment. Gather all the necessary equipment for the procedure. Here's a list of items you'll need. Catheter in the appropriate size, drainage bag, sterile gloves, water-soluble lubricant, cleansing agent, cotton balls or sterile 4-inch by 4-inch pads, forceps, non-allergic tape, sterile solution to inflate the balloon, sterile specimen container if indicated, sterile drapes, collection basin. If you're using a commercially prepared catheter set, most of these items will be included in the set. Explain the procedure to the patient. Before starting the procedure, it's essential to explain the process to the patient. Catheterization can be embarrassing and anxiety-inducing for patients, so it's crucial to provide clear information and reassurance. Ensure patient's privacy. Ensure the patient's privacy by creating a suitable environment, such as drawing curtains or closing doors to maintain their dignity. Hand hygiene. Before any medical procedure, it's imperative to wash your hands thoroughly to maintain aseptic conditions. Move the patient to the side of the bed nearest you. Raise the bed to a comfortable working height to prevent back strain. Lower the side rail if necessary. Help the patient assume the dorsal recumbent position with their lower limbs flexed and rotated outward. Insertion technique for an indwelling catheter. The insertion technique varies depending on the type of catheter used. Let's start with the steps for an indwelling catheter. Remove the drainage system from the bag and attach it to the bed frame. Place the drainage tubing conveniently between the side rail and the mattress, ensuring it won't fall during the procedure. Open the sterile catheter tray and don sterile gloves. Prepare the sterile drape by folding it with the plastic side down. Place it on the bed between the patient's legs, slipping the cuffed edge under the patient's buttocks. If necessary, add a fenestrated drape over the patient's genitalia. Place a sterile tray on the sterile drape between the patient's legs. If you're collecting a specimen, remove the lid from the specimen container and place it on the sterile drape. Squeeze a small amount of sterile lubricant into the catheter tray. If you're inserting an indwelling catheter, attach the filled syringe to the lumen valve of the catheter and check the balloon patency. Prepare the antiseptic cleansing solution. Proper cleansing is crucial to prevent infections associated with urinary catheterization. Cleansing a female patient requires specific steps. 1. Separate the labia. 2. Use forceps to handle antiseptic wipes. 3. Cleanse from the clitoris toward the anus. Repeat this process to maintain a sterile field. Cleansing a male patient involves supporting the penis with your non-dominant hand, using forceps to handle antiseptic wipes, cleaning the penis in a circular motion. Repeat the process for thorough cleansing. Female catheterization. Now, let's discuss the steps for inserting a catheter in a female patient. Pick up the catheter about 3 inches from its tip. Lubricate the tip of the catheter. Ask the patient to breathe through her mouth. Gently insert the catheter about 2 inches, or until urine begins to flow. Release the labia and hold the catheter securely with your non-dominant hand. Male catheterization. For male catheterization, follow these steps. Pick up the catheter about 3 inches from the tip. Lubricate the tip of the catheter. Draw the penis upward and forward at a 60 to 90 degree angle. Have the patient breathe through his mouth. Insert the catheter gently into the urethra. Gently advance the catheter until urine flows. Lower the penis and hold the catheter securely with your non-dominant hand. Place the other end of the catheter in the collection basin. In conclusion, the catheterization procedure is a critical medical intervention that should be performed with care and precision. By following the steps outlined in this lecture, you can ensure patient comfort and safety during the procedure. Remember that maintaining proper hygiene and aseptic conditions is essential throughout the process.
Urinary catheterization procedures. 1. Obtain a specimen. If you are instructed to obtain a urine specimen, follow these steps. 1. Place the specimen container in the collection basin. 2. Pinch the catheter with your non-dominant hand. 3. Pick up the drainage end of the catheter and hold it over the specimen container. 4. Unclamp your fingers and allow approximately 30 cc of urine to drain into the container. 5. Repinch the catheter and place the drainage end into the collection basin. 6. Allow the urine flow to resume. 7. Place the specimen container on the table and replace the lid. These steps are crucial to ensure the accurate collection of a urine specimen. Inserting an indwelling catheter. An indwelling catheter, often referred to as a retention catheter, is used to continuously drain the urinary bladder without the need for repeated catheterization. The most common type is the Foley catheter, which has a double lumen, one for drainage and the other for inflating a retention balloon at the catheter's tip. When inserting an indwelling catheter, follow these steps. 1. Inflate the balloon with the proper amount of solution from the syringe. 2. Gently tug on the catheter to ensure the balloon is inflated sufficiently to retain the catheter in place. 3. Attach drainage tubing from the collection system to the catheter without contaminating either. In some cases, the catheter may come pre-connected to the collection system. 4. The patient's facial expression is a valuable indicator of whether the balloon was inflated properly within the urethra. These steps are crucial to ensure the indwelling catheter functions correctly and remains securely in place. After completing the catheterization procedure, follow these concluding steps. 1. Remove your gloves. 2. Tape the catheter to the patient's body. For females, tape it to the inner aspect of the thigh. For males, tape it to the abdomen if ordered by the doctor, or tape it to the inner thigh. 3. Clean the genital area to maintain hygiene. 4. Reposition the patient, ensuring their safety and comfort. Finally, report and record the procedure in the patient's medical records.